Hello everyone, it's great to be here again. As you all know, I'm part of the Zwanger group and we are very much involved with early detection. We've obviously started with our mammography, which is the basis for the standard, the gold standard of breast imaging. We continue with ultrasound. Several years ago we started to develop an MRI of the breast program, and we're continuing on with even newer technologies. Two of the newest technologies that we have available now are PEM, which is positron emission mammography. Some people know it more as PET, which is positron emission tomography, which is used for the whole body. And now we're specifically targeting the breast to be able to add early detection. We started out offering it as a study for free for the patients who are having their PETs, and we found that it in fact was very useful. And we've actually started doing PET or PEM-guided biopsies of lesions that were not seen in any other arena. More recently, actually last week and over the coming month, we've started with another new imaging study with nuclear medicine called BSGI, breast-specific gamma imaging. And again, it's a way of early detection. Right now, we're going to offer it to all of our patients who are coming for biopsies as a way to see if it in fact will show the lesions that we're biopsying and how it correlates with what we find at our biopsy, and to see if we find additional lesions. Because again, early detection, as our previous speakers have said, is the key in our goal. This morning I was doing a couple of MRI-guided breast biopsies, and it's interesting the stories that you hear. The one woman that I was doing, she had disease on the opposite side and actually had a recurrence, and I'm doing her MRI-guided breast biopsy, and she had had an MR previously, a couple years ago, at the time when she was deciding what to do with her major surgery. And the story went that the surgeon who was involved in her care had discussed with the radiologist, and I think it was another practice, it wasn't ours, what to do about certain findings. And I guess at the time, they decided that they weren't going to aggressively pursue the findings in the opposite breast, and she went for surgery on the one side. And then as a follow-up, she felt something going on in the breast that was operated on, and so they said, well, do another MRI. And the MRI shows that the area that she was feeling was absolutely nothing, probably just some post-operative changes. But on the opposite side, there was again this spot. Now, what's interesting in my business is that for better or for worse, sometimes you can have different people look at the same image and they can come up with different opinions. And so the person who looked at it this time said, well, yeah, there's something there, and this time I think you should have a biopsy. And so that was the biopsy that I was doing this morning. And she said to me she was sort of upset that she wasn't involved in the initial decision-making process of whether or not she should have had a biopsy then, or maybe even had different surgery at the time. And so, it got me thinking a little bit. And one of the things that I try to discuss with all my patients who I do biopsies on is for them to really take charge of themselves and be proactive for themselves. I mean, they need to be an integral part of the decision-making process. I have many women who will come and I'll say, well, there's something there. And they'll say, well, what do I do? I said, well, now this is where you have to be part of the process. One person I will say is, there's something there, and if I tell you that I think 99 and 44/100ths ivory soap sure that it's benign, if you were my mother, if you were my wife, if you were my sister or my daughter, I would say it's nothing, we can follow it, and they'll say, fine, thank you very much, I'll see you in 6 months, and that's fine. And the next person you tell the exact same thing to, and they say, no, I can't handle that. I'm going to think about this every day when I wake up and before I go to bed, and I say, fine, for you, you should have a biopsy, and that way we find out what it is today. And so there are different decisions for the exact same finding based on the individual. And so the individuals really need to take charge and become part of the decision-making process. And that's what I encourage at Zwanger. At Zwanger, we try to offer all the various things that we can do to help with early detection. We're very aggressive about it. We enjoy being part of Radio for a Cure, and we hope to be for many years to come. Thank you.